Hey guys, what's going on? Banana156 here with another video. Remember to subscribe, like, comment, do all that stuff. I do read all comments, so make sure to leave one. But yeah, so let's get right into it. In this video, I'm going to be talking about the healthcare system in the US specifically, and how it is incredibly broken. So I just want to start this off by reading a medical bill for a transplant. The total amount that it cost the insurance company of the person was $3,171,897.40. Nearly $2 million. How are you supposed to pay for that without insurance? How? You can't. You just can't. It's $3.2 million. No one has that much money, besides like the top 1%. So I just wanted to start the video off with that, just to set the tone, kind of. So I'm gonna read off several statistics here, and yeah, and just talk about stuff after that. So first, the US spends more money per capita on healthcare than any other nation on earth. You would think that this would mean our healthcare was the best on earth, but it's not. It's the worst and most poorly developed in the first world. The US spends over $10,000 per capita on healthcare. But then there's places like Germany who spend substantially less than that and provide much higher quality care to its citizens. I don't know. Seems kind of The next thing is over 27 million Americans are uninsured. That's another problem. Germany guarantees healthcare to all of its citizens. The US, there's 27 million people who don't get it. And not only is there that 27 million, there's 25 well-insured Americans who struggle to pay their medical bills. Over 25% of well-insured Americans fail to pay their medical bills. That is ludicrous. 25% of people who actually have insurance. In places like Germany, you don't have to struggle to pay for your medical bills because it's free. And in other social democracies in Europe, like Norway, Sweden, France, Denmark. The next thing is 63% of people who had struggled paying their medical bills depleted their savings, meaning they got rid of most of their savings or got rid of all of their savings to pay for it. And not only that, 42% had to get an additional job to pay for it. That is absolutely absurd. And the next statistic I want to read is a few drug prices in different countries compared to the US. So for insulin, in Canada, now mind you that insulin is the same drug, come from the same company, same factory, everything is the same. In Canada, it's $32. In the US, it's $300. And that's one of the more tame examples. I'll read you a more ludicrous one. For the HIV drug, I forgot what its name was, but it's a drug for HIV, and its development was funded by US taxpayers, in fact. And in Australia, it costs $8 to get it. In the US, it costs $2,000 for an $8 drug. Over 500,000 people are bankrupted by medical expenses in the US. But why does this happen? Why is our healthcare system broken? Why is it so broken? Well, that's the thing. It's not broken. It's not broken at all. It's a for-profit system, meaning that it's doing exactly what it's designed to do. It's designed to make the hospital companies money, and it does a very good job of that. So, as time went on, in the 80s was when it really started to happen. By 1981, 1 in 7 hospitals were for-profit. And, that's when the thing started to happen. And if you look at American life expectancy now, it is lower than other developed nations, and it is also decreasing instead of increasing. If you look at other developed nations like in Europe or Canada, you see that the life expectancy is slowly increasing. In here, in the US, it is decreasing. That is terrible. The U.S. has the highest infant and maternal mortality rates of the developed world. And if you look at other countries, you can begin to see them. You see them take notice as well, because during the pandemic, a university in Norway sent out a letter to all of its students, saying, if you're studying in a country with underdeveloped or a poorly developed health services and infrastructure and or collective infrastructure, for example the U.S., you need to come home. They don't want their people in the U.S. because if they go to the U.S. they'll be broke because of the healthcare system. The next thing I want to talk about is I want to talk more about how it's for-profit and what that does. So a for-profit healthcare system is like any other for-profit system. They're not in it to provide healthcare because it's the right thing to do or because their citizens need to be healthy. It's because there's a big check involved. It's because you can exploit people for money, and that's just, well, that's the American way of doing things, isn't it? The next thing is why are the prices so expensive for things in this for-profit market-based system, but like the profit of other market-based systems aren't, or not the profit, the prices of other things in market-based systems aren't as ludicrous? So in like when you buy garbage bags, for example, garbage bags, the other garbage bag companies compete with each other, and it drops the prices. Like, like a market kind of should work. It doesn't really work that way here because there's like only one company that does it, or two. But that's how it works. Like, they compete with each other, so they lower the prices so more people buy their product. But when it comes to healthcare, you're selling life. You are providing the service of saving people's lives, and people will pay anything for that. Meaning it's an inelastic market, and therefore it cannot function like a normal market, because you think someone's not going to pay anything to live? Do you think anyone's not going to go into massive debt to live? It doesn't function. It can't be a market because there's nothing keeping the prices down, because people will pay anything to not die. That's why that happens. The next thing is I want to talk about how for-profit systems are always about streamlining and cutting anything that isn't profitable. And this leads to a thing called, or I forgot what it was called, but shipping things on need. So like during the pandemic, you probably noticed that there was a ventilator shortage and mask shortages and scrub shortages. And you saw this because doctors and nurses would take pictures of them having to wear garbage bags because they didn't have the proper equipment. This is because American hospitals do not get things. They don't have like an emergency supply of ventilators or masks or scrubs. They get those things when the need arises, so they can like streamline and cut all expenses as much as possible. That's the goal, so you can increase profits as much as possible. But then say when a global pandemic comes around and your hospital is at like 90% capacity or 95% capacity, you're going to need a lot more ventilators, you're going to need a lot more masks, you're going to need a lot more scrubs, and you won't have those things because you don't have an emergency fund of those things. You don't have like 100 ventilators in the back that are just waiting for this moment. You don't have that. So then that's why the ventilator shortage happened. And then not only that, it's not a centralized organization, it's a bunch of different other companies. So it was really difficult to shift, or to not shift, but ship ventilators across to different hospitals because they're different companies. It's not a centralized thing. So, and now for the next portion of this video, I wanted to just show a ton of medical bills and just read a ton of medical bills and read how ludicrous they were. But I don't think that will change anyone's mind, because the people who already are for universal healthcare are already for it. And the people who stand by America's healthcare system, I don't think that would change their mind either. So I'm not going to include that part. I'm just going to tell you that third world countries have better healthcare systems than we do. Cuba has a better healthcare system than we do. Mexico has better healthcare than we do. And we're supposedly the greatest country in the world. It's kind of funny. We're supposed to be the greatest country in the world. and our healthcare is the worst. Not only that, but a lot of other things that we do are the worst, and I will go over those more in depth in other videos. But I hope you guys enjoyed this video. It was fun to make. But yeah, remember to subscribe, like, comment, do all that stuff. I do read all comments, so make sure to leave one. But yeah, thank you all for watching, and yeah, I'll see you guys in a couple days. But I want to end this video with a quote. The U.S. has the third best healthcare system in North America, not including Central America. That quote was by Homer Simpson, and I just thought it was funny. But yeah, see you guys in a couple days.